Welcome to Let's Talk Health. My name is Dr. Jennifer Sankey, and I'm the Director of Possibilities in Health Ministries here at the Southeastern Conference. We are so excited that you've joined us today. Our program is designed to give you some practical, simple, but relevant information of health topics that are happening in our world today, not only in the world, but also in the church. Today, we are going to talk about mental wellness. And my guest today is Dr. Yvonne Saballo, who is a licensed mental health counselor as well as a registered nurse. Welcome, Dr. Saballo.
Thank you, Dr. Sankey, for inviting me here to be a part of this ministry.
So I'm so excited that we're going to be talking about our mental wellness. Did you know that 1 in 5 people experience mental health crisis? And did you know that 1 in 20 have a serious mental health problem? So Dr. Saballo, that is why we're here today to talk about how do we maintain our mental wellness. So tell me a little bit, when you hear the word mental wellness, what is that really all about?
Mental wellness includes our psychological, our emotional, and our social well-being. It affects how we think and how we feel and how we act. It also affects how we make decisions, how we respond to stress, and how we make choices.
Wow.
And that's our mental wellness.
So really, you've described mental wellness is so important because it affects our entire being. When you mention that it affects our decision making, sometimes we don't think about that if we're not mentally well, we don't make the best decisions.
That's right. We make poor choices.
Wow. So when we talk about mental wellness, what are some of the causes that can make us become a little bit imbalanced?
Yes. Well, let's talk about what causes us to have a mental disorder and not be mentally well. First of all, we will talk about biological cause. The biological cause could be due to chemistry in the brain. Sometimes if there's an imbalance in the chemistry, it can cause us a mental disorder. And also a structural damage. Sometimes you can have injured your brain or the degeneration of the brain cells. That can cause also, like dementia and Alzheimer's, that can contribute to a mental disorder. And then we think of genetic vulnerability. Maybe a family member may have had a mental disorder. But it's important, this is very, very important. Although you may have the gene, you do not necessarily have to experience a mental disorder. But it can be activated by stress. If you're chronically stressed, you can activate that gene, and that can cause a mental disorder. And then we think of psychological. When we talk about psychological, we're talking about our mind. And it's sad to say that sometimes little children suffer trauma such as physical abuse, sexual abuse, emotional abuse. And this trauma can affect someone into their adulthood. Also, an adult who may have experienced a very traumatic event, that can cause them to have what you call a PTSD, when memories of what has happened can contribute to a mental disorder.
So when you say PTSD, maybe our audience may not know what that means.
Please, let me explain. It's called a post-traumatic mental disease, in the sense that you've experienced a trauma, and when that memory comes back, it triggers off anxiety and depression.
Wow.
And I just want to also add, when I'm talking about psychological, what can cause us to have a mental disorder, our thought processing. Our thought processing, if we have a negative or pessimistic way of thinking, that is the biggest contribution to a mental health disorder. Because if you have a negative outview about yourself and about the world you live in, that can also lead to depression.
So it sounds like there's several causes.
Several
So
causes.
it could be stress, and I don't think people really understand that stress, how stress, prolonged stress affects us. Mm-hmm. We may not understand how even just isolating ourselves socially can affect us. Mm-hmm. We may not understand even, I love that you mentioned the negative thinking.
Yes.
Because sometimes people don't realize that if we don't guard our thoughts, then it progresses to a mental illness. So
Yes.
those causes are things that we can be, some of them we can change.
Yes.
So maybe we can't change our biological structure,
Yes.
but we can change our thoughts. Mm-hmm. We can make decisions about stress. Mm-hmm. We can make decisions about how we think from day to day. Mm-hmm. So let me tell you what comes to my mind. What comes to my mind is, in the morning how we wake up and we look in the mirror, we can choose our attitude.
Yes.
We really can.
Yes.
Just like we wash our face and get ready for the day, we can actually choose our attitude, choose our mental health attitude.
Yes. Yes. Our thoughts, and talking about that, our thoughts affect our emotions, and our emotions affect our behavior. And there's a text, Proverbs 23 verse 7. It says, "As a man thinks, so is he." So if we harbor negative thoughts, it is going to cause us to not be mentally well.
Well, I'm glad you brought in the spiritual, because many times we don't think about how our spiritual well-being affects our mental well-being.
Yes.
And those really are aligned.
Of course.
How we are spiritually does affect our thinking.
Yes.
And so I appreciate you bringing that forward. So let's talk a little.
Can I just give you some more reasons? Because it's important that we realize what are the things that can cause mental health.
Absolutely.
We've talked about biological, genetics, we talked genes, and we've talked about psychological. Let us remember also medical conditions can cause mental disorder.
Give me an example of a medical condition that maybe could cause a disorder.
Okay, an example could be a thyroid. If our thyroid produces thyroxine, and if that hormone is decreased, if there's a decreased amount of that, someone can behave as if they're depressed. And if it's too much, somebody can be very hyperactive, and that can cause one to believe that they have a mania. So that is the reason why it's important to understand that medical conditions can also mimic a mental disorder. And other conditions that can cause one to be depressed is like cancer, and other diseases, heart disease, any disease that the prognosis may not go very well for that person, that can also cause a mental disorder. And also lifestyle. I wanted to go back to that because I wanted us to know that our lifestyle can also cause a mental disorder. Poor nutrition, lack of exercise, abuse of alcohol and drugs. Those are the things that can cause a mental disorder.
Wow. You mentioned that our lifestyle, and I want to go back to that a little bit, because our lifestyle, whether we're eating properly or improperly, certainly it's going to affect our thinking. Mm-hmm. Whether we exercise or not, it's going to affect us as well. But one thing you mentioned were alcohol and drugs. What I'm finding in our society is when you go to the doctor for any condition, they want to prescribe a medication. And maybe it's not a street medication, but it is a medication. Mm-hmm. And those medications, can they have an effect on our thinking?
Some medication, especially if you become addicted to medication, you feel that your life depends on it.
Yes.
See, and it can encourage you to become addictive. Some people some people have a personality disorder that could contribute to addiction. Mm-hmm. So yes, medication, although it's necessary, it's also thought processing.
Yes.
If you feel that you cannot do without it, then you're now becoming dependent.
Yes.
And if you're becoming dependent on it, you're going to be using more.
So our mental well-being is really more about us taking control of our thoughts, our actions, and our behaviors.
Yes.
As a man thinketh, so is he, as you mentioned.
Yes.
So what are some of the signs and symptoms? Like I think you mentioned depression as being, one of the mental illnesses.
Depression and anxiety.
Anxiety are the two things that, so let's talk a little bit about both of those.
Okay. It's very important that you understand the signs and symptoms of anxiety and depression. And most mental disorders do have a combination of these symptoms. So, and I'm saying this because if you are feeling this way or you know someone who is feeling this way, it's very important that you do something about it. Very, very important. Now, the first sign of depression is when a person has a depressed mood. That is, they're sad for most of the day, most of the time during the week. It can be frequent crying, or sometimes it could be just being withdrawn from others. So a depressed mood, and they complain of having no pleasure at all in life. They do not enjoy the things that they normally enjoy. And no interest, no lack of motivation. Everything is slowed down. They're not able to do much. No energy, lack of energy. Sometimes a depressed person will have a problem sleeping, or they may sleep too much. And also they may lose their appetite. They could be losing weight without trying to lose weight. Or they might overeat. Some people overeat for comfort.
Yes, absolutely.
So, and then difficulty concentrating, difficulty making decisions. But the most important thing that we're going to look for is if someone complains of feeling worthless, hopeless, and helpless. That's a very, very serious sign to look for. And this depression, if it lasts for at least 2 weeks, the same behavior within the 2 weeks, it's extremely important that you do see your physician, because by seeing your physician, you can get help. Now let's talk about anxiety. And remember, the reason why I want to differentiate is because there can also be a combination of depression and anxiety together. Someone who is very anxious will have racing thoughts. They cannot stop thinking, and worrying about everything and anything at all, and of great fear. And sometimes the fear can cause them to have panic attacks. And panic attacks, when the heart starts beating, of course the blood pressure is going to go up, pupils are dilated, and they may have what you call sweating. The palms start sweating. Some people even complain of, especially when they're very anxious, stomach discomfort, or they say butterflies in their tummy. And then they get extremely irritable, reckless, and body aches, body tension, pain and muscle tension, sometimes headache, and all these things, and difficulty concentrating and having thought blocks. So if you find yourself feeling this way because you're very anxious about anything, definitely you need to be checked out.
So, Dr. Sabala, you have given us something to really think about. When we think about mental wellness, mental illness, it's like, how do we stay well? What is it that we need to do? But we do need to recognize that every person at one time in their life has symptoms of anxiety.
Yes.
And possibly depression. We do know that people have lost loved ones.
Yes.
They've gone through a divorce.
Yes.
Maybe they've lost a child. Maybe they've even lost a job.
Yes.
All of those can actually affect how we feel.
Yeah.
But if it goes beyond 2 weeks, is what you're saying, then that's when we need to seek medical attention.
I'm glad you brought up that about a loss of loved one, because there's a difference between sadness and depression. It's extremely. Sadness is an emotion. Absolutely. We all feel sad at some time, but it doesn't mean we're depressed.
Yes.
The most important thing to recognize, the difference between sadness and emotion, is that sadness, there is no loss of self-esteem. You're not feeling hopeless. You're not feeling helpless. No loss. And of course, you still have realistic expectations.
Wow. So, Dr. Sabalo, hold that thought. We're getting ready to go on break. And when we come back, we're going to talk about some practical solutions of how to work through depression and through anxiety. And so, audience, stay by. Keep your TV on. Stay by. We will be back in just a few moments. So welcome back to Let's Talk About Health. We're talking about our mental health, and we realize that everyone at some point in their life goes through some type of crisis. But we do know that it's important that we stay well mentally. Today, my guest is Dr. Yvonne Sabalo, who is actually a nurse, and she's done psychiatric nursing as well. Dr. Sabalo, thank you for being here today.
Thank you for having me, Dr. Sankey.
You know, you were talking about depression and anxiety as being common, can happen, can lead to mental illness. But there are times that people get into a mental health crisis.
Yes.
What are some of those signs and symptoms that we should look for?
There are times, if major depression, if it's not treated, someone can go into a major crisis. And one of the American Association for Suicidality. Let's go. My mouth is getting twisted here. They said that if the most important thing to look forward, if someone who has been depressed starts talking about hurting themselves, or they have ways of doing it, looking for ways, such as finding a weapon, a gun, a knife, or medication. If you hear somebody trying to do that, it's extremely important. And also, if they're saying that they want to die, writing about dying, or having these suicidal ideation with intent to act, it's extremely important that immediate action is taken.
So it sounds like that's an emergency. That's not are you sure that's what you want to do? It's not questioning them. But let's back up just a little bit. So before they get to that point,
what is that?
It's very important, I think you mentioned it before, is that they really should seek help, either from their primary doctor or go seek help or have someone go with them to the doctor.
Yes.
To make sure that they can get the treatment that they need. So let's talk a little bit about that, because I do think that that's important for our audience to know, that if you're depressed or anxiety, maybe the first step would be to see if you can get that individual to agree to go to the doctor. Yes,
that's very important, because we don't want to wait until we get into a crisis.
Absolutely.
Because depression, if left untreated, can cause psychosis. So it's very important, if you are experiencing any of the symptoms that I mentioned before, it's very important to see your primary care physician, because the primary care physician will assess you. They will assess you also they will do lab work to make sure that your electrolytes are okay, your chemical electrolytes are okay, and also you check your thyroid to make sure that that's okay. In other words, they're going to try to rule out a medical condition before they can they will diagnose you with. They will do other assessments to diagnose you for psychological problems.
You know what I'm really happy about, Dr. Sabalo, is whenever you go to the doctor now, there's a questionnaire, and they will ask you very specific questions about your mental health.
Exactly.
And I think it's very important that individuals know that you fill that out honestly.
Exactly.
Make sure that you write if you're feeling sad for more than 2 weeks, or if you have those thoughts of hopelessness.
Yes.
So I think that's one of the things that I believe has gone very well with the doctor's office and changing in our world, because we know that mental illness, you can't see it.
Yes.
People can smile and say, good morning, how are you? They can even say happy Sabbath. They can say many things, and you can't see that they're hurting on the inside.
Yes.
And I do know that depression and anxiety and mental illness, it does hurt.
Of course.
Because many times there's unresolved issues.
Yes.
As you mentioned, as a child, it still moves into adulthood. And so we have to be mindful that even though we see the smile, there could be sadness behind that.
Yes.
There could be someone even thinking about, maybe taking their life or harming someone else.
Yes.
I was looking at statistics, and I found that 1 in 6 children, sometimes we don't think that young adults have mental health issues. They have mental health issues.
Yes.
And suicide is really the second leading cause of death in children.
Yes.
And then I also read that mental illness oftentimes starts at the age of 14. So those are the children that may be in school, Sabbath school, different places, and we may not think that in their mind they may have that low self-esteem. They may feel stressed about what's happening around them as well. So I think that we have to be mindful that we must pay attention. That's probably my key word.
Yes. And in saying that, Dr. Sankey, I would also add, as a parent, with youth, be conscious of their behavior, because if you notice your child they're becoming withdrawn, isolating themselves from others, you notice behavioral changes is that they may become very aggressive, or they may become very weeping, or sometimes engaging in risky activities. Immediately let your light bulb go on, because you know your child, and if you can see changes, because sometimes children suffer silently, especially being bullied at school, and of course causing them to have low self-esteem. It's extremely important that we are aware of changes. So those are some of the things to look out for, and of course the signs and symptoms that I mentioned before.
Yes. I even think about how even if we see children changing, sometimes we just think it's hormonal.
Yes.
Or, but I think it would be good to even have time, whether it's with a spouse or a child or anyone in your environment at home, that you check in with them to see how they're doing.
Exactly.
Because how we say, how are you doing today? And we're so we're doing fine.
Yes.
But if you ask it a different way, and sometimes if you ask and listen long enough, you can actually hear what's going on in that mind.
Definitely.
How are things going at school? And maybe being very specific, how are you feeling?
Yes.
So I think asking the right question
Very
and
important.
engaging in conversation and taking time. We live busy lives.
Of course.
And so sometimes people say, I didn't want to bother you. But I let's move on to how really we see the signs and symptoms. They're in a medical crisis or a mental health crisis. I think that's an emergency.
Of course.
Absolutely.
It is definitely an emergency. And now sometimes you can have a crisis but not necessarily suicidal.
Yes.
But you call 911. The 911, which will take them to the hospital where they can be assessed.
Yes.
Because sometimes their behavior is completely bizarre. Sometimes so they need to be checked out too.
Absolutely.
If there's a crisis, 911. If suicidal, 988.
Oh, say that again.
No, 911 if the person is in need of immediate care.
Yes.
Because like we mentioned before, someone who can be in a mania, who is extremely irresponsible, doing things that they don't normally do, delusional. And definitely you want to make sure that person is being assessed, because sometimes they may not want to because they have unrealistic behaviors. So you may need to call 911 to get them to the hospital. And definitely for someone who's suicidal, you definitely have to call immediately to get help.
I think that's very important, because I know for many, many, many years, Oftentimes mental illness was not really even talked about in the church.
No.
It was really kept silent, and there were people who were suffering in silence. I like that word that you said, not really like it, but we need to make people aware that people are suffering in silence. And it's really important for us to provide them the resources or the help that they may need. So let's talk really quickly about protecting our mental health. That's really what we want to do, but there are times that we do need to seek out a counselor. And it's okay.
Oh, definitely.
A Christian counselor really would be great, like you say, to provide scripture and support. So let's talk about resources that people maybe can use, and then also end up with, finish up with talking about how do we protect our mental health on a daily basis. So let's talk about our resources right now.
Okay. Well, what I would say about resources, a lot of people, I'll go back to saying, if you're experiencing mental discomforts that I have mentioned before, and you see your physician, they will sometimes refer you. If you may need psychiatric treatment, your primary care physician can refer you to a psychiatrist, or they can refer you to see a counselor. Now, many times, if you have an insurance, you can get a list of
the providers.
You can get a list of providers that is within your or in the network of your insurance company. But also, there's lots of resources on the internet, believe it or not. There's lots of resources on the internet, and that they can take you to different counseling sites that can help you. So resources are out there. It's for you to reach out. The Hosea 4 verse 6 says, "My people perish because of lack of knowledge." So if you're experiencing any kind of discomfort, reach out to your primary care physician, who will refer you to someone who's a professional person who can help you.
Wow.
And of course, the internet, a lot of people find counselors from the internet.
Wow. I like that you mentioned about, lack of knowledge, because there's so much out there now.
There's a lot out there.
And you can choose, you can put in Christian counselor if you want a Christian counselor.
Yes.
I know here at the conference office, one of the things that we're very focused on is trying to get a directory of Christian counselors, so that we can at least provide resources to individuals who may want to seek out someone within the Seventh-day Adventist faith or the Christian faith. Again, that's something, a work in progress. And so we would say, in the meantime, please go ahead and seek out those resources on the internet. So for these next few minutes that we have, Dr. Sabala, I want to let's talk about how to protect the mental health. We've talked about what it is. We've described it. We've talked about the causes. We've talked about the signs and symptoms. But I want us to talk about what can we do on a daily basis.
Okay.
Our audience wants to know.
Okay.
What can they do on a daily basis to protect their mental health?
Yes. When we talk about the mental health, we're talking about our mind.
Yes.
Okay? Our thoughts. I'm going to repeat this again.
Yes.
Our thoughts affect our emotions, and our emotions affect our behavior. But our emotions also affect our body, because the mind and the body are interconnected.
Yes.
So let me explain to you now how you think. If you are constantly having negative thoughts, the goal here is to reframe those thoughts into something positive.
Yes.
Now, we didn't get a chance to mention therapy, but if you're experiencing problems and you do see a counselor, their goal is to change the negative thought processing. So how can you do it now to help yourself, to prevent you from having to go? You're going to practice gratitude, and spend time in the Word.
Amen.
Spend time with God. Take time to be quiet. And I'm going to say meditation, but sometimes meditation just means being still, reflecting on the blessings that you have had, and practice just enjoying what you have, the simple things in life. Exercise is very important, very, very important, because by exercising, you're actually releasing hormones like endorphins that can calm the body and help you to relieve stress, because chronic stress is a precursor for mental disorders, especially anxiety and depression. And as we look around in the world today, there's a lot of stressful things. So in other words, you're going to learn how to decrease stress. Decrease stress by changing your thought processing to thinking more positive. Taking time for self-care, making sure you're having an adequate amount of sleep, 7 to 8 hours a day. You're going to eat healthy. Food is extremely for the brain. You need to give good nutrients. I'm saying the brain needs good nutrients.
Yes.
Let me not speak fast now.
Yes.
So you're going to eat healthy. What do we need? Fruits, vegetables, especially leafy green
Yes.
vegetables. We're going to have omega-3, which we could get if you're not a vegetarian, fish. You get your omega-3 from fish. And I mentioned nuts, right?
Yes. Or even flaxseed.
Flaxseed
is really good.
Flaxseed is good.
It's
Yes.
really good.
Yes.
Yes.
And you make sure you get in your vitamin B12, your vitamin D, sunlight, exercise, and relaxation techniques.
Wow. So you have given us a lot to think about.
Yes.
So audience, so we now know that in order to protect our mental well-being, we need to think positive thoughts. There's a verse in the Bible that says, I will keep him in perfect peace, whose mind is stayed on thee. And so as we talk about mental wellness, eating right, thinking right, exercising, and being in the Word are the simple things that you can begin to do at home and to help balance your mental wellness every single day. Check in with yourself. And Dr. Sabalo, I want to just pause and say thank you so much for being here today. Because again, this is a topic that we want to make sure that we not only inform people about, but we want to transform their lives mentally, physically, and spiritually. And what you've given to us today can help us achieve that goal. So what I would say to our audience, be sure that you subscribe to our channel, like us, because there will be more information about Let's Talk Health from the Southeastern Conference. Again, my name is Dr. Jennifer Sankey. I'm the Director of Health Ministries and Possibilities Ministries, and we want to make sure that you are informed as well as transformed, because your health matters not only to you, to me, and to God.